since you have a lot of diseases, so I guess tricky question would be, which disease would you wish that you like to disappear?
It's actually a pretty easy question for me. I would definitely give up ME-CFS in a heartbeat. So, as you said, chronic fatigue syndrome, or it's sometimes called myalgic encephalomyelitis, is a condition that has the biggest impact on my day-to-day life and has puts the biggest limits on what I can
Okay.
do. And it's also, I would say, the one that still has the most social stigma attached to it. Even just the fact that it's called chronic fatigue syndrome, some of us feel like that's a little offensive, frankly, because it's a very debilitating condition that causes a lot of different symptoms. And I can't remember who I heard this from, but somebody said that it's like calling dementia chronic forgetfulness syndrome. There's so much more to it than just that one symptom. And unfortunately, there are still quite a few doctors who choose not to believe in it, despite the fact that there is so much evidence for it now. And there are still countries, including the one that I live in, where there are still forced interventions that are proven to be harmful for us. So things like graded exercise therapy or cognitive behavioral therapy.
Was it love at first sight getting these tools, like using these tools, or was it a lot of self-ableism towards yourself?
Mm, that is a good question. I would say once I actually started using mobility aids, it was definitely love at first sight because they just helped me so much in my day to day life. Because,
Okay.
as you said, my presentation of my hypermobility has progressed the older that I've gotten. So, I actually used to be quite
Hmm.
fit when I was in my late teens and early 20s. And it was around my mid 20s that my symptoms started to get a lot more severe. And then I started using my crutches in
Hmm.
2021, and it just helped my stability so much because I was starting to have issues with things like
Hmm.
falls, and it helped with my fatigue. It helped take the strain off some of my joints that were more painful. If you have more like mild to moderate ME like I do, it's good to still keep moving within your limits because that's healthier for your
Hmm.
body. You can maintain a little bit of muscle tone and things like that. And, that's why I'm fortunately still able to do
Hmm.
things like physical therapy. And so I would still keep walking short distances because I would like to maintain that little bit of conditioning that I still have. But absolutely, if I was having like a flare up or something, and I felt awful, or there was like some kind of like big important event that I really needed to save my energy for, I would definitely
Hmm.
use it more so that I could conserve that energy, like you said. Yeah.
Even though it might be painful to like walk, you still kind of want to do it because you just don't know if tomorrow or next week you won't be able to walk again.
Yeah, definitely. I am like very aware of how fortunate I am. There are a lot of people with ME/CFS who can't do any physical activity at all, and they don't even have, if they have a comorbidity like EDS, they don't even have the option of managing those symptoms and managing their pain like that because they're too unwell to move. And so, yeah, I'm very eager to make sure I take
Hmm.
advantage of that as much as possible. And as you said, like it is just nice to, yeah, like maintain some sense of, I don't want to say normalcy because there are different people living their lives in different ways. There's no one normal, but yeah, we want to stay capable within our limits, like you said.
Well, since we're talking about a lot of your disease and it seems to be crippling in some ways, but you can manage them, but I think not crippling is still a good word to use. So, like, do you feel like you're free though?
Hmm. I think it's a really good question. I feel like I am free to be who I am, and I feel like I am free to keep evolving as a person in the ways that I want to and evolving in a way that allows me to live well with the body that I have. And I think that's come
Hmm.
from me confronting some of my internalized ableism that you've alluded to before. I used to live in a way that was very in denial about my disability and wanting to cover it up, even though like I live with multiple mostly related conditions. They do have competing needs, like we were just talking about, in terms of needing to do some stabilizing exercises for my EDS, but also having to pace and conserve the energy for things like my ME-CFS and my fibromyalgia. I am always walking this like tightrope of activity and having to really prioritize things in my life. And,
Hmm.
that can feel very limiting. And being hyper aware of plans like that can be a big burden, especially with ME-CFS. There is always the possibility of relapsing into a more severe state. And how we treat ourselves and how we respect our energy limitations is a big part of that. When it comes to things like disability, we have to sort of find a balance between we need to feel confident and empowered to do what we want to do and realize that, you know, social barriers aside, oftentimes we have the capability to do at least some of the things that we want to do. You made that comparison actually between catcalling and what we were just talking about, because I actually feel like they have very much similar energy, like sexual harassment and then like disability based
Hmm.
harassment. And I think like I think it's fantastic that you have that attitude about going out and like having to roll with it, and you have that fantastic like self-esteem and belief where you don't let those things affect you. But I suppose I don't agree, like when you say, well, it's a normal part of life. Maybe it is, but it shouldn't be a normal part of life. And that's why I still like talking about it, because I guess, I mean, maybe I'm naive, but I still think eventually, we can encourage society to lift its standards a little bit with how they treat us, and, understanding that they're not entitled necessarily to pass nasty comments or ask invasive questions when they see us.
I see a lot of disability people in the world that they're like trying to change the world, but I'm just like, you really can't change the world. It's just, yes, the world sucks a lot of ways. You gotta go with it because if you keep fighting against it, you're just gonna tire yourself out. So you might as well just ride the wave instead of fighting it, or just gonna like there's all other things you could worry about and kind of just do you, like just go out and just keep doing you.
It's good to be goal driven.
Hmm.
I'm trying to get better at being more grateful for what I've already gained. So, like you said, I think back on about how I was once bedbound, and it was slow, steady progress to getting better at that time. And now I've come a
Yeah.
long way. I'm up. I'm doing this, for example, which I wouldn't have been able to do a couple of years ago. And yeah, it's important to stay grateful for
Yeah.
what you have already gained. And, there was a time in my life where I would have loved and been so excited to be able to do something like this. And so I have to try to focus on appreciating that
Hmm.
too.
Hello, welcome to my podcast, Two Mics, One Joe Suits. I'm Joe Suits. I'll be giving my to Jess. Jess is a delicate little petal because of her fragile skin. She is currently dealing with fibromyalgia, endometriosis, hypermobile spectrum disorder, chronic fatigue syndrome, and mast cell activation syndrome. Would you like to play a game to start off this
Sounds
podcast?
fantastic. Let's do it.
Since you have a lot of diseases, so I guess the tricky question would be, which disease would you wish that you like to disappear?
It's actually a pretty easy question for me. I would definitely give up ME-CFS in a heartbeat. So, as you said, chronic fatigue syndrome, or it's sometimes called myalgic encephalomyelitis, is the condition that has the biggest impact on my day-to-day life and has puts the biggest limits on what I can
Okay.
do. And it's also, I would say, the one that still has the most social stigma attached to it.
Kind of, I'm just assuming, just saying like, oh, like she did something else, so like, why is she not there? Or like, I guess you have a friend be like, oh, you hung out with this friend, like, why are you not hanging out with me? Something like that.
I would say like there's a number of reasons. So there used to be some very harmful information out there about the condition, and even just the fact that it's called chronic fatigue syndrome, some of us feel like that's a little offensive, frankly, because it's a very debilitating condition that causes a lot of different symptoms. And I can't remember who I heard this from, but somebody said that it's like calling dementia chronic forgetfulness syndrome. There's so much more to it than just that one symptom. And unfortunately, there are still quite a few doctors who choose not to believe in it, despite the fact that there is so much evidence for it now. And there are still countries, including the one that I live in, where there are still forced interventions that are proven to be harmful for us. So things like graded exercise therapy or cognitive behavioral therapy. And those treatments are basically administered, like they're both treatments that can be very helpful for people in different situations, but they're administered from the perspective of basically that ME-CFS is not a real disease and it's something psychological that we need to sort of get over and recondition ourselves from. But forcing people to physically recondition themselves if they have ME-CFS is actually linked to them deteriorating more long term. So it's quite dangerous.
I'm just kind of familiar with the surface level of it, and I don't have it. So it is. I'm thinking like with disability that you do have, I'm assuming that contributes even more to your chronic fatigue. Like I get lower your battery capacity. Is that a fair way to put
Battery
it?
capacity is actually a great way of talking about it. I know that you have spoken to a number of people before who have hypermobility related disorders like Ehlers-Danlos syndrome, and so I'm sure they've spoken about their
Hmm.
fatigue too. And so, yeah, it can be really challenging having multiple conditions that do cause fatigue, and it's actually quite a common comorbidity. Like a lot of people who are living with fibromyalgia or Ehlers-Danlos syndrome or some kind of symptomatic hypermobility are also living with ME-CFS, and there's not really
Hmm.
a clear understanding yet of why that is, but there is definitely evidence that there's a lot of overlap between those conditions. So yeah, it is really hard.
I feel like Ehlers-Danlos is like kind of. It says it's a rare disease. And I feel like it's a rare disease in quotes. I feel like it's not though because I remember at one point I was just like interviewing like all these Ehlers-Danlos syndrome, and I just feel like there's a lot more out there than I originally thought. And I feel like a lot more people have it. They're just not diagnosed with it, or just like see it as a nuisance, but like can't like put a finger on it. Kind of like in your case, like it took you a really long time for you to get your diagnosis.
Yeah, that's exactly right. And I think you've brought up a really interesting point because what's tricky, I think, when you start talking about the Ehlers-Danlos syndromes as a rare disease is that a number of the types of Ehlers-Danlos syndrome, like classical and classical-like and vascular, some of those variations are genuinely very rare and they fit into that category of, I want to say it's like 1 in 200,000 or something. That's the criteria normally for a rare disease. But
Hmm.
when you have people with hypermobile Ehlers-Danlos syndrome, which is the type that I have, most people think that that's actually not rare. It's just rarely diagnosed correctly. And so we as a society have the
Hmm.
illusion that it's rare, but it's actually not that rare at all.
Yeah, I mean, I
Mm.
totally agree with you just but I'm also just one person dealing with, I only interview my like 130th guest, so I can't really say if I interview 10 elder journalists, I'm gonna say, oh, it's really popular, it's just, as if you're in a field like at all. I mean, it's also kind of like a invisible disease, like you're not gonna know if someone has it on the street unless they see them with crutches or anything, but even then, crutches could mean so many other things too. 'Cause, like I know, so let's talk about mobility. So like I know you've been doing it with yourself, and I'm assuming you were able to walk long distances for a good while, and then got shorter and shorter over time, and then you used to use braces, and then you said like your wrist was hurting, so like that was causing fatigue, and then you went to elbow crushes, and that was helpful to a lot. And then now you use the scooter, like you just went on vacation and use the scooter, so like was it love at first sight getting these tools, like using these tools, or was it a lot of self-ableism towards yourself?
Mm, that is a good question. I would say once I actually started using mobility aids, it was definitely love at first sight because they just helped me so much in my day to day life. Because,
Okay.
as you said, my presentation of my hypermobility has progressed the older that I've gotten. So I actually used to be quite
Hmm.
fit when I was in my late teens and early 20s. And it was around my mid 20s that my symptoms started to get a lot more severe. And then I started using my crutches in
Hmm.
2021, and it just helped my stability so much because I was starting to have issues with things like
Hmm.
falls, and it helped with my fatigue. It helped take the strain off some of my joints that were more painful.
Yeah, just to add to that, like I have kind of walking issue, but like different, but same. But people don't realize, but it's balancing yourself actually requires a lot of energy. Like I know everyone just does it like nonchalantly, but like if you don't know how to walk and you're just balancing is actually really fatiguing. Like I was surprised how fatiguing it was.
Yes. So would it be correct for me to say that FOP is also like something that affects the connective tissues? I mean, I know it's in a completely different way, but
I yes and no. Like what my condition is does so that my muscles turn into bone, so bone is
hmm
growing everywhere and it locks the body into place. So like feel like for you, you're able to like move and like your joints come out of place and like you have to like put them back into place. For me, my body just doesn't move ever. So like it's kind of the same, but like different, like
yeah, I
complicated,
mean, well,
you
yes, I
know?
mean, they're completely different illnesses, of course. I'm sure that you have like your own
Yeah,
unique challenges that I wouldn't have to deal with, but I think maybe that's why we see eye to eye
yeah,
on the proprioceptive and balance stuff is because it's still like those soft tissues in the
yeah,
body that are responsible for helping us balance, and neither of us have control over them properly
yeah,
for different reasons.
yeah. Well, the only difference about me is that like, no matter how bad your body gets, it's still kind of the same body. Like, yes, your joint might go out of place, but like, you can put them back and, like, you can still be your regular self. My body has, like, transformed into, like, a weird, so, like, my legs are not fully straight anymore, so, like, I'm in a squatting position. And I'm also on my tiptoes, so that's a lot of like balancing in itself. Just being on the tiptoes alone is balancing, and it's just like it's a lot of like weight shifting, and
Mm.
like you're also not walking as much anymore, so you're kind of getting weaker
So
over
you have to
time
you have to keep
too. So it's kind of
adapting
like
to the way
back,
that your condition is impacting you, and that must be really hard. Yeah.
yeah. I mean the thing is that I'm just in a unique position that no one can really like helping them is just always it kind of like everyone that has my disease is always the same. You kind of have to figure out yourself. But like there's people that just can't walk at all. Just because your body just not able to like if my legs were to be bent just a little more, I wouldn't be able to walk at all because it's like almost physically
Yeah.
impossible to do. So like it's different in that regard. But yeah, it's interesting. Just like I'm a very fascinated person by everything, and it's always like not like when me growing up, I never thought like, oh, I would never walk again, but it's always interesting to be like, oh, like balancing requires a lot of effort now, and like walking and just and like taking stuff for granted for like there's nothing I could have done. Be like, if I had one more day, like of course I would do so many things, but I wouldn't. There's nothing that could be like would make me happy if I had like one more day of walking. It's just like I'm gonna have a grieve about it for the rest of my life, but that's like I can't do anything about that.
Yeah, definitely. No, that's true. And I think the example that you gave before about how balancing takes a lot of energy is a perfect example of that. Most people do take that for granted because it's not something that's difficult for them.
Hmm. Yeah, but let's talk about you. So like you getting these braces to help you balancing and stuff. So like now are you in a situation like so let's say you're in your apartment, can you just walk by yourself or do you need support
I
now?
usually, so on like the nice smooth flat floor in my apartment, I usually just need a cane just to help me balance. But with a cane,
Okay,
I can quite easily walk short distances. And then these days,
okay,
for outside, I prefer to use a rollator as much as possible because I live in Brussels where the
okay,
streets have very uneven cobblestones and it can be a little difficult with
yeah,
crutches sometimes. I think even a lot of
So
really
yeah,
healthy people have trouble with joint pain here because, it's not super nice on your joints to have that
it's
like
horrible.
unevenness all the time. Yeah.
Yeah, that when they first designed the road, I'm sure wheelchair was the last thing they thought of at the
Yeah.
time.
Yes, and Brussels is a very historic city, and on the one hand, I understand the dedication to
Yeah,
preserving it the way that it is, but sometimes I think we just could do with redoing the roads.
yeah. I mean, yeah, I get why like they do cobblestone because probably cheaper like durability and such. But I can't imagine like if you had like your horse and buggy, like that must be so awful to go on those roads. Like it,
Yeah,
they should have invented concrete like a couple of hundred years past would have helped so much now.
definitely.
Yeah. So like I know like you're in the process of getting a scooter now, so like I'm guessing you just use your scooter just for longer distances.
Yeah, so there's a couple of reasons. Well, I'm in the process of applying for a scooter. I originally wanted to look at getting a wheelchair that was more adapted to the situation with the cobblestones that I was just describing, but unfortunately, I'm not eligible for that.
Yeah. Wait, is that something you can actually say on like your form, like have difficulty going over cobblestone, please write me a prescription.
Well, I mean, how deep should we go into this chaos? Look, I'm sure you've been through it before if you've had to apply for mobility aids through insurance, but I mean, the application process is quite in depth here. I'm sure it's probably the same there. And there is a part of the application which is like basically says like explain any particular circumstances that, contribute to the you requesting this exact type of equipment. And I did put the fact that we live in a particularly gnarly cobblestone area as part of my application. But unfortunately,
Mm-hmm.
at the moment, because I can still walk unassisted for short distances, I'm not eligible for that, but I am eligible to apply for a scooter. So that's why we're doing that. And that's mainly because, as you said, longer distances are still really hard for me because of pain and fatigue. Even though, like, things like my joint
Mm-hmm.
braces and my crutches do make it easier, I struggle a lot with pain in my spine and neck still. And I have had just an enormous amount of different types of physical therapy over years. And unfortunately, it's just not really getting better. So I am at the point where I would just like to find a way to improve my quality of life and be able to walk around more because part of the challenge is it's quite difficult for me to catch public transport and I would like to be more independent. I would like to be able to
Mm-hmm.
get to my medical appointments by myself. I would like to be able to just like go buy groceries and stuff by myself. But those sort of like big kind of steps up from the ground to like a bus, for example, are really difficult for me. And so that's why something like a scooter would help me out so much.
I mean, I feel like if you're having at most the chronic fatigue syndrome, just I feel like you just use the scooter all the time because your battery capacity is low, so you might as well. If you don't have to walk, you shouldn't walk, so you can use your energy for other things, right?
Yeah, so it's a really difficult balance because even though deconditioning is not the cause of ME-CFS, like it can make your symptoms worse. So if you have more like mild to moderate ME like I do, it's good to still keep moving within your limits because that's healthier for your
Mm-hmm.
body. You can maintain a little bit of muscle tone and things like that. And, that's why I'm fortunately still able to do
Mm-hmm.
things like physical therapy. And so I would still keep walking short distances because I would like to maintain that little bit of conditioning that I still have. But absolutely, if I was having like a flare up or something, and I felt awful, or there was like some kind of like big important event that I really needed to save my energy for, I would definitely
Mm-hmm.
use it more so that I could conserve that energy, like you said. Yeah.
So it's kind of like a weird catch-22. Like you want to keep moving, but you also want to conserve for other things. Like it's like a weird balance
Yeah.
for you.
I guess, in a way, it's similar to maybe like what you were explaining about how, as the position of your body has changed a little bit over time, that presents additional challenges for you because
Mhm.
then you're getting weaker, for example. And I'm fortunate
Mhm.
because I still like have the option to obviously keep moving my body, but I
Mhm.
have that catch 22 of like, well, energy conservation and pacing is the most effective management strategy we have to stop ME-CFS from getting worse. But at the same time, I don't want the symptoms of my Ehlers-Danlos syndrome to get worse because I need to maintain some muscle tone to help my joints stay in place and have less dislocations and less
Mhm.
pain and things like that. So finding that balance is really hard. And I would say that's probably the main challenge for me and also for like a lot of other people in my situation too.
Yeah, I mean, I can also think of it. You also have like pride and like a sense of like I guess privilege could be the right word to like that you're still able to move, so you still like kind of want to like still embrace the movement you do have. So like even though it might be painful to like walk, you still kind of want to do it because you just don't know if tomorrow or next week you won't be able to walk again.
Yeah, definitely. I am like very aware of how fortunate I am. There are a lot of people with ME/CFS who can't do any physical activity at all, and they don't even have, if they have a comorbidity like EDS, they don't even have the option of managing those symptoms and managing their pain like that because they're too unwell to move. And so, yeah, I'm very eager to make sure I take
Hmm.
advantage of that as much as possible. And as you said, like it is just nice to, yeah, like maintain some sense of, I don't want to say normalcy because there are different people living their lives in different ways. There's no one normal, but yeah, we want to stay capable within our limits, like you said.
Well, since we're talking about a lot of your disease and it seems to be crippling in some ways, but you can manage them, but I think not crippling is still a good word to use. So like, do you feel like you're free though?
Hmm. I think it's a really good question. I feel like I am free to be who I am, and I feel like I am free to keep evolving as a person in the ways that I want to and evolving in a way that allows me to live well with the body that I have. And I think that's come
Hmm.
from me confronting some of my internalized ableism that you've alluded to before. I used to live in a way that was very in denial about my disability and wanting to cover it up because, as you said, EDS is often an invisible disability. And so we do have the privilege of
Hmm.
passing as able bodied sometimes. But I don't always feel free in terms of my actions, even though, like, I live with multiple, mostly related conditions. They do have competing needs, like we were just talking about, in terms of needing to do some stabilizing exercises for my EDS, but also having to pace and conserve the energy for things like my ME-CFS and my fibromyalgia. I am always walking this like tightrope of activity and having to really prioritize things in my life. And,
Hmm.
that can feel very limiting. And being hyper aware of plans like that can be a big burden, especially with ME/CFS. There is always the possibility of relapsing into a more severe state. And, how we treat ourselves and how we respect our energy limitations is a big part of that. And unfortunately, there's no treatments, there's no cure for this condition right now. And so self management is the only thing we have. And even though I am currently kind of between mild to moderate with mine, I have been in a severe state in the past.
Hmm.
And frankly, that was a
Hmm.
really traumatic time in my life. I was bedbound, I was suicidal at times. And so that is a fear in the back of my mind that one day I could go back to being in that state. And that does make it really hard to feel free.
Yeah, totally understand what you're trying to say. It's the same basically. You are free, but you kind of have like strings attached to it. Like, yes, you can do all these things, but like, is it worth it to you of like like you can do a lot of things today, but then tomorrow you'll just be like bedbound just from fatigue and just no battery at all. And it's like you kind of just divvy up your priorities, I guess is a good way to put it.
Yeah.
And like, yes, you do have freedom to do anything, but like, do you really want to though? Like, not really, like, you rather put your energy into other things that are more important
That's
to you.
exactly right. Yeah.
Yeah, I mean, that's a good way to go. I feel like a lot, even if you don't have any condition, I think that's just a good way to go in life to kind of get away, uh, get away from the bullshit of life and just like focus on things that just really matter to you, that are important to you, that mean a lot to you. Like, you don't have to pay attention to every little detail. Like, life is long, but also life is
Yeah,
really
that's
short
so true.
too.
It does really make you think about what really matters in your life and yeah, think about your priorities and things like that. That's definitely true. But it is honestly like I can be a little bit of a hypocrite sometimes, to be honest. Like yeah,
Hmm.
I do tend to still worry about things sometimes I know don't maybe matter that much in the long term. And I think kind of, I guess, reprogramming your brain in that sense
Hmm.
can be really hard.
Yeah, I mean, it's kind of whatever you're born with, you're just dealing with that. I mean, they're kind of all traumatic events, really. You're always in that mindset of, okay. But yeah, it's also weird when you're like a disability advocate, or really any person, like, we are all kind of hypocrites in the end. Like, the more, like, especially online, because, like, you can keep posting and you can, like, go back in time and be like, oh, that wasn't, like, a year ago. Like, oh, I totally didn't listen to my own advice. I'm just these hypocrites. But, like, yeah,
Yeah, that's true.
like, we all had that moment. So weird. It's like, ah, man, like, should I, like, stay in this field at all? Or, like, like to me, like most people don't care though. They kind of like see you as one. But like we all change as people to an extent over time.
Yeah, that's true. That's true. I think like having the psychological distance when you're trying to help other people is sometimes easier than helping yourself, you know?
Yeah, and that's a huge one for a lot of people. Like sometimes, um, I think like a good psychological thing people do is like, would you like to be treated the way you're being treated now? And then that person will be like, no, and it's like, so why are you doing it now? And they'll be like, oh my
Yeah.
God, like you're so right. Like let me change my ways. Like
Yeah,
holy
for
shit,
true. Yeah.
breakthrough. Yeah, yep. I mean, I did like to think that we're all reacting to what's happening in our lives at that moment
Hmm.
too, because like if you just take things out of context, doesn't make sense. Well, like what context makes sense, but like there's so much to life that if we just get lost in ourselves, really, like no one's like worrying, no one's like cares about us. If that makes sense, like they're worrying about their own shit. Like there's so much out there that
Yeah,
like
yeah. It's called
you just gotta keep moving
I
forward.
want to say it's called like the spotlight effect or something like that, where we think that people are more aware of like how we look and what we're doing and stuff than they actually are. But
Hmm.
it's such a strong psychological phenomenon. It's really hard to be free of it. Yeah.
I kind of try to prove it with my like Instagram of like people don't care as much as you think people do. I think like the biggest problem people have is just really self-esteem and like anxiety. I feel like it's kind of orchestrated by your own self and like most people don't care. So like I have a video of me 2 feeding in like the middle of a park and it's like most people like don't care. Like yes, it's medical and kind of unique and you don't see it. But like no one's like maybe they'll look at you for like 10 seconds and then go away or like I look weird. Like I'm clearly physically
Hmm.
disabled. So like you see me in a wheelchair going out the street, there's definitely something wrong with me. But like they just look at me for like 10, 20 seconds and then they just forget about me and people are just too stuck in that like oh my God, they're thinking me on dinner time and like oh my God, like no, they're not. Like I just try to be realistic. Like if you think about yourself, like I'm sure you've seen like beautiful people. You see them for like 10 seconds and then you think about them 5 minutes later. No, like they're totally figment of your of your memory. So like I feel like that's just happens to people too. So I'm kind of just do what you want to do in life because at the end of the day, like no one really cares except yourself.
Yeah. I totally agree. I think like when it comes to things like disability, it's we have to sort of find a balance between we need to feel confident and empowered to do what we want to do and realize that, you know, social barriers aside, oftentimes we have the capability to do at least some of the things that we want to do, and that, you know, the choice
Mm-hmm.
to, as you said, I mean, I know for you, for example, you are in a situation where you don't have a choice but to use a wheelchair. But for, I guess, people who have an invisible or dynamic disability, they maybe have to actively make the choice to use a mobility aid or to do something that's visually obvious like that to help themselves. You know, we need to know that that's a personal choice, and that ultimately it only affects us, and we have to put other people's opinions and reactions out of our minds. But at the same
Mm-hmm.
time, I'm curious about like what your experiences have been with things like street harassment and stuff because of your disability, because I feel like that is a big problem for a lot of people, and I do think it's equally important that we, you know, educate people and, you know, make people aware it's not okay to harass people, for example, on the street because they have a visual
I
disability.
honestly did. I honestly just don't care. I'm a very like realistic person. Like people are just gonna be naturally curious and like do whatever, and I just have like I did have to roll with it. I can't like be hurt by it because if I'm hurt by it all the time, it's just not gonna work out. Like I don't have to go outside and anything. I could stay indoors to the day and die. Like could do that. Like order out for food and all that. Like I don't want to though. Like put myself out there. Like I just start filming my videos outside because for one, I can make an opinion in my room and be like all safe and
Mm-hmm.
cozy and be in my limited bubble and just do my information from social media, which is toxic in itself. Or, I could go and talk realistically among the people outside. And, like, if you watch my video, like, you'll see people, like, they'll look at me and then just, like, keep walking. Like, I feel like that in itself is good advocacy because you can do the stuff. Like, I'm but like now I'm looking at a camera, I look really dumb. Like when you're watching a YouTube video, that looks okay, but like you're seeing like the behind the scenes, it looks really stupid. I'm just talking to a camera, like obviously I'm talking to you, but like if they don't see the screen, I was like I mean, but everyone knows what a camera is, so like obviously you
Mm-hmm.
talk to and but still like I don't. I'm just a realistic person. Like people that can be curious about it, they're gonna ask me any questions or like talk, make any opinion they want. Like I shouldn't be alive. Like it's totally fine. I think that's just what I think that's just a normal part of life, really, honestly. And I have to like grow with it. I can't just be afraid of it. Like, yeah, I'm gonna deal with bullshit, but like, I feel like it comes with just being a disability person. Like, I kind of real, I kind of like apply it to like being a woman. Like, you just go out there, and I'm sure you get sexually harassed without even doing anything. Like, you could wear like the most revealing clothing and get catcalled, and you could be the most conservative person on the planet and still get catcalled. But like you still go out there anyway if you want to walk to the park or you want to do something else, and like you still do it even though you had bad experiences. So I just feel like just go and do it because if you're gonna almost feel worse. Like I'm sure there'll be days where like it got really bad, or like I don't know, you got catcalled like 30 times. Like I understand that, but like.
I think it's so interesting that you made that comparison actually between catcalling and what we were just talking about, because I actually feel like they have very much similar energy, like sexual harassment and then like disability based
Mhm.
harassment. And I think like I think it's fantastic that you have that attitude about going out and like having to roll with it, and you have that fantastic like self-esteem and belief where you don't let those things affect you. But I suppose I don't agree like when you say, well, it's a normal part of life. Maybe it is, but it shouldn't be a normal part of life. And that's why I still like talking about it, because I guess, I mean, maybe I'm naive, but I still think eventually, you know, we can encourage society to lift its standards a little bit with how they treat us, and, you know, understanding that they're not entitled necessarily to pass nasty comments or ask invasive questions when they see us.
I mean, I get where you're coming from too. Like I'm not gonna disagree that. the world is like a shitty place, but like you can't really do anything. Like just like I know disability people have been around for like forever, but like I feel like in the last 20 years there are more and more people out there, especially like improvements of technology with like wheelchairs and stuff, so people are more going out in the world. So I get that, but like women have been dealing with catcalling for like 100 years, even more probably, and they're still doing this. So like yes, there are the horror stories that social media provides. So like it makes you like not want to go out. It's like really bad. Like with interviewing someone and we were talking about sexual harassment. So what she gets in her DMs and like it's so bad. Like what people I don't think like I'm a great person, but like I'm not the greatest person ever. But I'm also not like a piece of shit either. But like I couldn't even think of like some of the things these guys would say to women that's like insane. Like even as like if I attracted to someone, I wouldn't even think like any woman would be like, you know what, I want to go and sleep with this guy because he said the comment. Like it's so like bizarre to me. But
Hmm.
like
Yeah.
this, I have to roll with it because if I did go into my room after one comment or 10 comments, it's just kind of, like makes me feel like I want to like go out in the world and do things. But like I also understand my privilege because I think like one thing is I think I'm just physically disabled, so it's more explainable to like why I need wheelchairs. I think I'm a privilege in that regard. I think another privilege is being gay too, so I understand that. And like I don't deal with as much. I don't think I would deal as much comments toward me I do it compared to you. So I can't. I don't think the experiences are the same. So like I don't
Yeah.
know. Like if you were in my shoes and you dealt with that, I think you might have a better time in life versus you if you got more self-esteem going on. Like I can't. Like I see where you're coming from, but I feel like I'm not experiencing the
Right.
same. Just think the same. Like yeah.
I guess.
No, you go. You can finish your
Yeah. No,
thought
I
and
was just
I'll
going to
go.
say maybe my mistake there was like assuming that you would experience similar things because I suppose like if anything, I would have thought because for me, I I can pass as an able-bodied person, especially with my crutches. People tend to just think
Mm-hmm.
like she has an injury or something. They don't necessarily think, oh, she has like a
Mm-hmm.
serious long-term disability. And so I would have thought that you maybe would be experiencing problems more frequently than me, but maybe not. I think like you've added a really interesting perspective. But yeah, I mean, regardless,
I
you're right.
yep.
Like we can't control what other people do. We can only control our own attitude and how we respond to
Mm-hmm.
it. Yeah.
Yeah, like the only like annoying thing I get is like I get like deck clears like when I go on the bus, get like my wheelchair takes like 3 seats and it's always like sometimes it's a busy bus and like people are sitting and so like they have to get up because I'm on it. So like I get death stares about that, but like you really can't do anything about
Yeah.
it. Like yes, it sucks, but like you know what sucks more? Being in a wheelchair and like being here, like okay, But like I see a lot of disability people in the world that they're like trying to change the world, but I'm just like, you really can't change the world. It's just, yes, the world sucks a lot of ways. You gotta go with it because if you keep fighting against it, you're just gonna tire yourself out. So you might as well just ride the wave instead of fighting it, or just like, there's all other things you could worry about and kind of just do you, like just go out and just keep doing you. And I think like a lot of disability people also don't go out as much, and then they go on Instagram and they see all these bad things that happen, so they're more likely to not go out anymore. And I'm just like, I want everyone to experience life too. Like I think like the world in itself is beautiful. Like I do understand that like people have conditions and they can't control it, they're in a lot of pain and stuff. And I do get that, but I think like the world in itself is beautiful and like to me, to go outside, like every time I go out, I always feel like it's a privilege to do that.
I tend to agree. I think that there are a lot of great things out there, and I think it is really important. Like, even though we do have some unfortunate experiences sometimes, the people involved in that do
Hmm.
tend to be the minority, and it's important, I guess, not to let those experience color like our perception of the world as a
Hmm.
whole.
Yeah, like the way I think about it, like right, if you look back at memories, like I don't know, let's say you like go to the beach and like like you had a lot of problems going to the beach and stuff, and yeah, like you do have problems, but when you look back at it, you don't really remember how you got there. You just remember like, oh, I had a really great time at the beach. Now you might remember like, oh yeah, it was really difficult, but you don't really remember the difficult times. You remember the good times of it. So that's kind of what I think about. You just think like the good time. Like to me, I'm a very like goal oriented person. So like, oh, I'm gonna be going to Central Park today. I'm gonna go to Central Park regardless of what bullshit I have to go through. And I feel like that's good because I feel really good about it because it's better than sitting at home and feeling good, but like then you're not living life either, and that's not a good thing too. So you might as well just go with it anyway, and then you never know, maybe you'll have a good day. Like I know you went on vacation, and I know you had your worries, and but like you got a scooter that worked out really well, and then you're also seeing a lot of people didn't even look at you. And like you said, that really helped you so much too. So like like you kind of have to take a chance and maybe you'll have a good time too.
That's right. Yeah, we had a really good experience when we were in Amsterdam. Having the scooter really helped, and I think that's what it comes down to. Is as much as I agree about the importance of having the right attitude and still taking risks, we still need the right tools and supports in
hmm
place to be able to properly take advantage of those things.
I mean, to me, I don't know like what your friend circle is or anything, but like I don't have anyone around me to like make me feel better, if that makes sense. Like I'm just doing me at this point. I don't have anyone that fills my cup really. Like I'm just 100% go through it with it, and I don't like have support of it. So like I'm very self-reliant on myself. Like I just just growing up, I always just been alone, so like I always had to like pump myself up afterwards. And but like I think life is a lot of bullshit. It's like if you want to like do a great thing, you have to just go past the bullshit. So like me, like just to give an example, like me doing the podcast, like I interview 120, 30 people, but like you don't see all the time that people ghosted me or never even read my message and stuff. And it's like a lot of work and stuff. And like you just gotta go to the bullshit. Like sometimes it's really bad. Like I'll get 20 straight rejections in a row. And it's like, should I even keep doing this anymore? Like this is exhausting for a lot of people. But I just keep going because like my version of it, like I want the popularity. I want to get new guests. Like this is something I have to do it. Kind of like anything. Like you get a job, like of course it's never going to be that great. You have a great time, and sometimes you can deal with shitty bosses and stuff. Like, are you going to quit about it and stuff? No, you kind of need the money, so you got to pull yourself through it. So like kind of what I think, like I want to enjoy life and stuff. Yeah, I have to go through bullshit of it, but I think it's also like you also mentioned it, like you were bedbound and suicidal at one point. So you kind of, I feel like that's always in the back of your mind. So like when you say you don't want to go outside, but you think yourself to that person, like there was a time where I couldn't get out of bed and stuff. So, like I could go outside and stuff, and like I'm gonna do it because I was in that situation for 8 years where I couldn't get out of bed, like like 2 to 3 years and different times of my life. And I think about myself, but like there was a time where I couldn't even leave my bed. Now that I'm healthy as not as ever, but like as healthy as I can be, I'm gonna go and do it anyway. Besides the bullshit, 'cause I don't know. The next week I might be bedbound again for another 2 years. Like I don't want to live in regret either. So gotta keep it going.
Yeah, I think it's really important to, as you said, like something I struggle with actually is tend to sometimes focus too much on what I'm not able to do or what I guess like my goals. And even though it's good to be goal driven,
hmm
I'm trying to get better at being more grateful for what I've already gained. So, like you said, I think back on about how I was once bedbound and it was slow, steady progress to getting better at that time. And now I've come a
Yeah.
long way. I'm up. I'm doing this, for example, which I wouldn't have been able to do a couple of years ago. And yeah, it's important to stay grateful for
Yeah.
what you have already gained. And, there was a time in my life where I would have I would have loved and been so excited to be able to do something like this. And so I have to try to focus on appreciating that
Yeah.
too.
Yeah, I mean, everyone kind of going through their own journeys and such, and like, yeah, it's great to see the progress you're making. I mean, I just don't ever say no ever, like, I'm gonna say yes to everything, and to keep pushing my body to. I think it's also just a little bit different because I'm not dealing with the chronic condition of it. So like, do you ever feel like kind of guilty or like you're in the mindset you always want to do these things, but you can't because of like the catch 22 that you could do it today, but like tomorrow like, you're gonna have like a shit day. Like, are you kind of in that guilty mindset sometimes?
Um, I'm not sure if I would describe it as guilty per se, but I agree with like the sentiment of what you're
Hmm.
saying. I think that I suppose it is different because, particularly with fibromyalgia and ME-CFS, the post exertional malaise that we get when we go outside of our energy envelope can be awful and often not worth most things. So it can be hard because I may feel guilty saying no to something because I know it's not the right choice for my body and my sanity.
Hmm.
But sometimes I also maybe feel a bit guilty if I do push myself to do something fun, or maybe I just didn't calculate what I was capable of very well and then I have a flare up. That can be hard too. But it gets easier with practice. Yeah.